Federal Ministry of Health have confirmed the first case of COVID-19 in Lagos. The case is an Italian who entered Nigeria on the 25th of February from Milan, Italy. He came for a brief business visit. He fell ill on February 26 and was transferred to the Lagos State Biosecurity Facilities for isolation and testing. COVID-19 infection was confirmed by the virology lab of LUTH, that's Lagos University Teaching Hospital, part of the lab network of the NCDC. The patient is clinically stable, as we're told, with no serious symptoms and is being managed at the Infectious Disease Hospital in Yaba, Lagos. But the Lagos Commissioner for Health, Professor Akin Abayemi, says, quote, "We're working to identify all the contacts of the patient since he arrived in Nigeria. Please be reminded that most people who become infected may experience only a mild illness and recover easily, but it can be more severe in others, particularly the elderly and persons with other underlying chronic illnesses." So I'll be observant about that.
I think it's good that the various agencies and government arms are telling us what to do, basically, not just leaving people to panic and go into overdrive. But if you take a look at this on a global scale, as at this morning, 6:23 a.m., worldwide, 83,387 confirmed cases the world over. That's plus the one in Nigeria. And you see total deaths as a result of the COVID-19 is at 2,858. But the part you probably not get to hear a lot is the total recovered, the fact that people have recovered from COVID-19, way more than the people that have died as a result of this. That's 36,557.
And if we look at that, mathematically, we're probably saying that the chances of recovery are more than the chances of dying from it. Now, the number of countries we have seen that have been affected, including Nigeria as at this morning, 55 countries, and the country with the highest case, 78,824, is mainland China. South Korea comes next with 2,022 cases. And on and on, you see US, Germany, number of European countries are also on that list. And of course, 3 African countries as well. The country where Italy, where the Algerian and Nigerian cases came from have 655 cases. In fact, we also understand that others, through cruise ship, there are 705 cases, and that's really something to give one concern, right, especially since we hear that there are many ships who are yet to berth at our own seaports.
Well, not to raise any panic, but at the moment we've got Dr. Adalapo Ashinyobi, who is a public health physician. He joins us here in the studios. Good morning, and thank you for coming in today.
Good morning.
Could you give us a picture of what we have on our hands?
What we have on our hands is what we did not wish for, but we cannot say it's unexpected. Going through the data you just displayed to Nigerians, everybody's eyeball was focused on China, but Italy is number 4 on that list. So if you're going to talk about probability, then the first 10 countries should actually be on our mind, or even all countries, 55 countries where you've had cases, should have been on our mind. Up until day before yesterday, should have been 54 without Nigeria. So now with Nigeria, it's 55. So all those countries should have been on our mind for us to raise our awareness. Now, there are 4 major things that govern spread of disease that we call epidemiological quartet. 1, time. When does this start? So started in China, but it has spread to 55 countries. Place, 55 countries should have been on our mind. Then persons, where is this person coming from? Or who has this person had contact with? So if you look at those 3 basic things, most importantly, would have given us an idea of what is likely going to happen. Now, let me bring it back home. If you're looking about place, the likelihood of it happening predictedly is Lagos, because the easiest way for it to move is flights, and the best and biggest airport is in Lagos. And therefore, the Lagos airport was prioritized. It was really prioritized. So the chances of, secondly, Lagos is the commercial and business hub of Nigeria. So if people want to do business in Nigeria, they'll probably have partners in Lagos. Even if they come from Abuja, it's likely Lagos is going to be where it's going. Like I said, we didn't want it, but epidemiologically and expectedly, it has happened the way we are. Now, the most important and great joy for Nigerians is to see that the health system has responded all within 24 to 48 hours. The case was found, confirmed, and now isolated. Now, Nigerians need to know the difference between isolation and quarantine. You isolate people who are highly suspected or confirmed. You quarantine people who may be contacts, but they are still well. So we misuse this term, but it's not the way it should be. Now, the other thing we should look at is what the Senate said yesterday.
So if you don't mind, before
Yes,
we go there, because what I want to ask is actually related to what the Senate said. The federal government, the Federal Ministry of Health, and even State Ministry of Health have told us repeatedly of how prepared we are, how very, very confident they are that this no suspected case could go through. Yet here we are. You also said that Lagos was prioritized, but the distance between Yaba and the airport is quite some kilometers. How that was able to happen is something that I'm wondering. Even though we were, as you said, the Port Health Services was really prepared.
Well, the thing about it is, you can only prepare. Your preparation may have a gap, not because you didn't prepare, but because of what you never could have prepared for. Example, there are about over 30 cases all over the world now, right? That there is no epidemiological linkage to China. For example, in the US, the vice president was made the head, and the latest case is probably tagged unknown because they could not trace how the person got in contact with somebody either from China or Italy or any of the 54 other countries.
But the Italian case is particularly surprising to a lot of people. It just
didn't come out of the blue. They could trace their own index case. No. The index case. For example, this Italian case is our index case. And we know where it came from, Italy. Italy has a case. Now, the Italian case, the index one, is the real key to their own issue. So if they knew where the index case came from, then they're cool.
But so
it didn't fly. Now, answering your question, so how did we miss it? We may never have known. Apparently, the person wasn't ill when he got here on the 25th. He got ill after he had passed the screening. So there's no way you can take everybody in the flight. Best you can do is, do you have a temperature? Or you use an infrared thermometer. Now, if the person wasn't ill, but was incubating it, you would never have known.
And that's the thing. Exactly. Because if we were told yesterday that 80% of those who eventually exhibited, they don't, some of them, you don't even know that you have that symptom.
Yeah.
But I think part of the question that will come up in the days ahead is going to be that we don't know how long. Would they eventually be able to find out how long he might have had it before he now fell ill the next day after passing through the port services?
That's not important now to control. What is important now to control is get all his contacts. Going into all that is an academic exercise that will not help us. So we should focus our resources on getting all the contacts from when he got on the flight, but more importantly, those on the flight that disembarked in Nigeria. Because some may not disembark in Nigeria, so it may not be important. Now, but those that disembarked in Nigeria and their contacts and his own contacts from when he got in to when he fell ill, the transport, the hospital, the contacts in the hospital, at home, then if he has children or people that he works with, his employed in contact, his children, their school, everybody will put on the contact list and they will be followed up for a minimum of 21 days and probably 42 days to double the incubation period for us to be 100% sure that they did not develop symptoms.
I remember when you walked in, you were like, there's no need to panic. Just to tell Nigerians that take it easy, allow the people in authority to handle this. So people are looking to the government, the Ministry of Health, the NCDC. So what kind of response are you expecting? Because as they say, time is of the essence. So from this morning, what string of events, what string of responses are you expecting from those in authority?
All right. So there are three things that happens: detection, containment, control. So detection is already done. We already know. Containment, the case has been put in the isolated area. So that case will not be a problem. Now, control is the main issue now. Contact tracing, people, communication with the public, strengthening the health system from bottom up, from the primary health care to
How do you do that?
Exactly. Now, that was, I said that I was very glad with the reaction and the Senate resolution yesterday. The resolution was not vague. It was maybe somebody gave them an insight. And the resolution was that they want the people and the health minister to work with the primary health care system to ensure that nobody goes amiss. Why the primary health care system? It is a bottom-up approach. Every one of us live in a community, and every community is in a local government, and the primary health care system is in the local government. Now, every local government in Nigeria, 774, have primary health care coordinators and have disease surveillance and notification officers. So we have a foot soldier of 774 that you can talk to. Now, add 774 by 2, the medical officers of health or the primary health care, that is another 1,400.
We don't know how prepared they are.
They are prepared. If you do not get information, you cannot control anything. So what the Ministry of Health at the federal and the state should be doing is deploying these foot soldiers as people who easily communicate with the communities.
But don't forget, he raised concerns about the port health services at the airports in Abuja.
Yes.
And then this came through Lagos.
Yes.
So naturally, there'll be more questions concerning, we don't even know, well, you also did say that we're looking at China.
Yes.
And then this. So we don't know the thinking on the port health services, if there was special focus on all of those on that list, or it's just a regular thing for everybody else anyway, since screening is screening.
There are levels of responsibility there are responsibility for every level of government. So I was starting with the primary, which is the widest, which is the biggest dragnet we have. Now, that dragnet, you probably know one doctor, or you attend one private hospital. Now, the dragnet is such that those hospitals should talk to the local government, DSNO and PSC. So if you're ill and they think something is wrong, so they just call them. The way they call them, they tell them, this is what you need to do, before we even start panicking. And then we can follow up what has happened from there. So it goes up the chain. Now goes to this. So goes to the states. The states, okay, what do you have? We have a biosecurity hospital. So most likely, the case will go from that hospital straight to the biosecurity containment area. But the biosecurity officer will not accept you if you have not been diagnosed. So that's where the network of labs come in. So the federal government owns LUT. They have a good lab. So they take the sample, take it to LUT, hold the person in that primary hospital. You don't transport until you are sure that is confirmed, or you are highly suspected from the history. So either the primary or where the containment is, you take the sample to where it can be diagnosed. And then when they tell you it is negative, everybody just relaxes. But when they tell you it is positive like this, then another set of response kicks in.
But doesn't it, sorry to jump in, doesn't it vary from individual to individual? Because if you say the moment they tell you it's negative, if other persons, okay, well, if you were negative,
if you nobody's at risk
because
from you.
You can actually recover.
Yes.
And somebody who contacted from you don't recover.
Yes, if you're in the recovery phase. But the test is not that, it will not pick that. What the test will pick are immune antibodies, that even if you recover, there will still be history of you having had it. Like you've recovered clinically, but biochemically, you won't have recovered.
Even if they say you're clinically stable?
Yes, yes. Because the body itself has an immune system. So that's why some people may actually never display any symptoms.
By the way, I just wanted to get a clarity on that,
Yeah.
that phrase, clinically stable, because that was in the statement from the Ministry of Health. What does it mean? Is
Clinically stable that you're well, you're not seriously acutely ill looking, you're okay. Either you're recovering or you have not gone down the bad health state.
Oh, so it could go two ways.
Yes.
Oh,
Cool.
interesting. Now, you mentioned, pardon me, primary health care, which is important. And we've talked about primary health care in this country. And what we have said so far mainly is the fact that we don't seem to be getting it right at that point. So looking at our primary health care, I mean, if we're going to depend on them to ensure that this is curbed, do you really think we're ready? Seeing what the Senate said in the front pages, do you really think we're ready for that?
I think we're ready. Nobody really focused on that level of care. And people think they don't exist. So in all these stories, all you hear is the state government, Luth, and all that. But I can bet you that while the case was discovered in the hospital may have called the state government. Then the state government will tell the disease surveillance officer and all those primary health care system people, please, could you go and confirm for us? Like the rumor that happened in Ali Mosho like 3 weeks ago, quite a lot of people saw it on social media. So at the local government level, the local government chairman is the head of the Emergency Preparedness and Response Committee. So in Ali Mosho, what happened? The local government deployed every resource, political, financial, economic, to go and confirm the so-called Chinese person in Gowon Estate. And everybody was speaking. Funny enough, the street they mentioned doesn't even exist in Gowon Estate. And the federal government wouldn't have known that. The state government would have, but the community will know that. And they will speak to the local government chairman because they know him. They elected him. They will speak to their network of politicians and civil servants there and the health team. And then they were able to inform the commissioner of health that, sir, let's take a chill pill. There is no street like that in Gowon Estate. So the story is false.
Does that then help or harm the fact that there's been inadequate communication about this possible scare, this possible outbreak of coronavirus? Because many people wonder if they have enough information about it to prepare themselves or to check themselves just in case.
Okay, well, this responsibility is multi-sectoral. There are two key things in primary health care: community participation and intersectoral collaboration.
Community part hasn't really been...
No, it is. Look, it is not every wedding that started. It's not every relationship that gets to a wedding, and it's not every wedding that you publicize how it started.
Interesting analysis.
Yeah.
No,
so
but...
let me tell you why
Okay.
I said that. What you hear on the social media news is when it has become big. But every single day, there's an information system that tracks from the community to the ward, the political ward, to the local government, every blessed day. And so it is always there. But you will not hear it until you hear...
But that's the problem.
Hold on. Not the whole world you hear it on this media. I'm sure channels cannot carry every single information and rumor that emanates from the community.
No, we don't do that. You're right on that.
No, rumors are also
I get
part
your
of
point,
the
actually.
information system because if you don't dispel them, they take root and become a very big mahogany.
You know, another important thing about this is that, yes, he went through the port health services, then the next day he got ill.
Yes.
It means that could happen again. One could have it and not know, and then you get through and you... So how do we change that?
All right, so three major, okay, let me call it four. The health system has 6 components, but let me talk about 4 that may help us. 1 is governance and leadership. So who takes charge at every level of government or every area of the health system? So I'm speaking about government. So look at the port health system. There is a head. And the port health system is under the Federal Ministry of Health through this NCDC. So there's an NCDC head. Then there's the Federal Minister of Health. Then there is the Senate and House Committee Chairman here. Then there is the President. Now, let me use Lagos State as an analogy. The governor of the state from information, has taken over as the incident manager for emergency preparedness at the state level, because he's the one that can deploy everything and anything. At the local government, like I told you, the local government chairman, 57 of them, have taken over as incident manager of the emergency and preparedness section. Now, what did Trump do yesterday? Vice President, on my authority, take charge. So we need something similar at the federal level so that every single resource and person and community and political force will be brought to bear to ensure that we control this. So that's the governance and leadership. Now, there's the aspect of, I'm picking on the weak areas. There's the aspect of finance. Funny enough, it's only in this country that we want to solve our health system. And 80% of our budget is in the teaching, tertiary, and federal health system. And less than 5% is deployed to the primary healthcare system that has the greatest reach. We are now standing the pyramid on its head, and it will definitely tilt. So we need to change that. Deploy resources to where it will be most useful, not, Luth is very beautiful and big, and the PHC behind your house is very small and inconsequential, but they'll probably get the news faster than before the minister gets it. So we need to change our financial focus. So now, human resource. There are many more health workers in the secondary and tertiary system compared with the primary healthcare system. And they cannot do magic because it's just the number of human resource you have that you can deploy. The same thing with the port health. They're very thin because those who handle port health services, I'm not sure there are as many as those who are in one general hospital in one state. So and remember the number of flights that enter this country. Now, we need to move to the next level of control and containment for the flights now. It will no longer be thermometer alone. If it's possible, we need to do some form of personal disinfection for the aircraft and people before they disembark, so that even if you have it and you have contaminated a surface on the airline or in the airport, now, that would have helped a bit.
So now, is this going to be flights coming from where? Are we just going to narrow down to 55 now?
Yes, because we now know. Well, that is what we have to do. So
that's deploying resources, which you talked about.
Exactly. Resources, finances. That's why I said the president has to take charge. And now there will be good use, result-oriented use of resources. The resources are four: man, money, materials, and moments. The 4 M's.
Very, very quickly, I don't know if this is of a concern to you. The case in Egypt was said to be by a foreigner, not an African. There are 2 cases in Algeria now, 55-year-old and 61-year-old. Both are foreigners, not Africans. The one in Nigeria is that of a foreigner, not an African. Is that something to cheer? Or?
No. The world is a global village. You cannot stop people from moving around.
No. I mean, is it something to cheer that no African is infected?
That's probably going to look at it from a very narrow angle. Of course not. Okay. The moment is in that country, then all the health workers who are now Africans are exposed. All their family members, all their acquaintances. I'm sure this Italian does not work with only Italians alone.
But what is it they say about the weather?
Wow.
It was Antarctica, don't forget.
Yeah. Well, because this virus is new. I mean, it was December, the first time ever. Yeah. Nobody has enough information to give you all the evidence-based things to make an informed decision. We're all learning every day. For example, when it started, not enough people realized that from yesterday, 36,000 or 53,000 people recovered. That's about 40% recovery rate. But it was until we got to 83,000, we counted those that recovered to learn that the success rate is like 40%. So most of the information we're getting now is new, based on evidence. However, if we look back using SARS, because coronavirus is also a severe acute respiratory infection. So if we use the SARS model or the Middle Eastern Respiratory Syndrome model, they are both upper respiratory tract infection.
Just quickly,
Yes.
as an individual,
Yeah.
briefly, what should I do? Now there's COVID-19 in Lagos. What can I do?
Yes, wash your hands, be clean, environmental hygiene. Please, this is not the time to go treat yourself at chemists, to go treat yourself, or just go and do a lab test because you are feeling somehow.
Does that also apply to Agbo?
Yes, this is not the time. If you do that, you would have wasted enough time. Let's assume that I'm ill, and I'll go to a chemist to get drug, and finally I become a case. That means that chemist person is in trouble. And everybody who went to that chemist is also in trouble. And so that becomes difficult to track. So anybody who is ill now, please go to a hospital.
Especially if you have those three main
Any illness at all. We're all looking at corona. Lassa is still there. Other diseases are still there. So please use the orthodox health system for now.
We know
And
people
I know
love their
we'll be
traditional
safe.
medicines, but this
This is
is
not the time.
more than that. It's
please.
bigger. It's something huge. We need to actually cooperate.
Can I quickly say one thing?
Yes, please.
This brings me back to the Singapore case. The Singapore case became very problematic because it was discovered in a secret, how do you call it, religious sect.
I think that's South Korea. There was
South Korea, yes. So we have similar sects here in Nigeria. And we have similar religious practices. So you hear some people say they have gone on the mountain to pray.
Well,
So we should be careful,
We also know what happened
link
to
up with
Iran,
them.
how
Exactly.
they stopped prayers because of this. So this is very important.
So we should
All right. Well,
put
thank you.
everybody on board.
We
Thank
do
you
thank
very
you for coming on, Dr. Oladapo Ashinyobi, who is a public health physician. Don't forget the tips are there. They will always be there. What you can do to prevent yourself.